following presentation has no commercial support to disclose. It's a recording of a webinar organized by the University of Toronto and the Dalla School of Public Health. This is a recorded session from a presentation that took place on December 7th, 2020. The topic of this presentation is regarding the catch-up of those who were not immunized because of the COVID-19 pandemic. So due to the emergence of the pandemic and the public health measures to lock down and prevent the spread of COVID-19, there have been a cessation of many immunization programs across the country. The general consensus and strong recommendations all the way from the WHO down to the BC CDC and nationally through Immunize Canada is that the continuity of immunization during the COVID-19 pandemic is essential. Immunization is an essential service. We now find ourselves in a predicament where we have individuals who are behind in their immunizations. Our immunization rates are lower due to the disruption of the pandemic, and we also have the impending challenge of perhaps the greatest immunization delivery in the 21st century with the emergence and the soon-to-be approval of a COVID-19 vaccine candidate. It's very clear that we need to operationalize everything we have in order to robustly immunize our population and improve the health of our communities and fight back against infectious disease. This begins by asking the right questions. The right questions are, how do we optimize what we have in a system where we provide immunization services to our communities across the country? Pharmacists present a very emerging yet underutilized resource when it comes to community immunization services. Pharmacists have continued to increase the amount of influenza vaccinations nationally, starting from 2012 all the way up to recent day, where pharmacists now have emerged as the highest, as the place of where most people receive their vaccinations in the community. So pharmacists have overtaken physicians' offices and community health centers to be the highest proportion of vaccination for influenza. Now, there's a few important caveats of this statistic. The first thing is this is sort of a redistribution. So we're seeing the same amount of people immunized, and what's happening is more and more of them are getting immunized at a pharmacy, and this isn't resulting in more and more people getting vaccinated. However, with the COVID-19 pandemic, we saw an increase in the amount of influenza vaccination uptake, which is positive given the fact that we have to combat the twindemic with the emergence of COVID-19 and other seasonal respiratory viruses, which include influenza. Now, with this increase, now we've seen more and more influenza vaccines administered at the pharmacy. So not only has there been a redistribution of those already getting immunized, but with the emergence of new individuals getting immunized, perhaps for the first time against influenza, many of them are being done at the pharmacy. So pharmacy has shown that they can handle the volume and an influx of more people needing to be vaccinated. The other challenge is optimizing the visit. So the National Advisory Committee on Immunizations provided this guideline when it pertained to adult immunizations in order to offer as many vaccines as required to minimize the risk and reduce the number of healthcare encounters, thus reducing the risk of acquiring COVID-19. So essentially, we wanted to turn immunization visits into a one-stop shop, therefore optimizing the visit and providing as many recommended immunizations as indicated for the patient. Now, the challenge with that is there are certain barriers for pharmacists to provide not just more influenza vaccines, but also to provide catch-up vaccines for those who have missed it in, for example, school-based programs, and also recommending individuals on certain recommended, whether they're funded or not, vaccinations. Ultimately, how do we leverage pharmacists to deal with an increasing demand of not just patients needing immunizations, but immunizations themselves? So some challenges in pharmacy-led immunization services. The first and foremost one I want to bring to your attention is scope of practice. So across Canada, not all pharmacists have the same scope of practice. As you can see in this diagram, there are a combination of green check marks and red boxes. And that indicates what pharmacists can and can't do based on their jurisdiction. And when we look across each province and we look across each territory, there is a heterogeneity regarding what pharmacists can and can't do. There are provinces that have more green check marks, and there are territories that have more red boxes, and the distribution and the location of those green check marks and red boxes are very different when it comes across different jurisdictions. What I want to focus on is the pharmacist's scope of immunization. Now, if you notice, we go back to this diagram, that injection authority for vaccines and influenza vaccine is largely green across most provinces, with the exception of a few provinces and territories. Now, the challenge, though, however, is if a pharmacist can administer a vaccine, that's one thing, but the other thing is there is also heterogeneity in terms of what vaccines pharmacists can administer with or without a prescription, or even at all, depending on where that vaccine is categorized. There are very different and complex jurisdictional regulations. For example, in Ontario, there is a certain list of vaccines a pharmacist can administer with a prescription, and there are vaccines that they cannot. So this presents a challenge. If we're truly going to optimize the visit and provide all of the recommended vaccines for a patient, we need to have the scope in order to do so. The second challenge is distribution. So in terms of pharmacies as receiving medical products such as medications and vaccines, it's ideal to have them delivered directly. At this time, there are, again, heterogeneities across the province where some provinces actually do not get publicly funded vaccines. So they are unable to provide essential publicly funded vaccines such as MMR, tetanus diphtheria, and the polysaccharide pneumococcal vaccine. For some provinces, they can receive it. However, there is no direct distribution. They have to get it from their public health unit, and in doing so presents a barrier not just for the immunizing pharmacist, but also for the patient who presents for the immunization, and again, resulting in multiple visits. Ideally, there should be direct distribution of all publicly funded and recommended unfunded vaccines delivered directly to the pharmacy so that the pharmacist can assess the patient and provide all of the vaccines they need and order them directly, whether they're publicly funded or pay out of pocket. Pharmacy education is also a challenge. There's an absence of clinical immunization training in pharmacy curriculums. New pharmacy graduates get the technical skills needed to provide immunization safely. However, there is a lack of high-level clinical application when it comes to age and risk-based assessment for immunizations. There's also a lack of specialized outpatient practicums. In particular, those pharmacists working in the community are unable to have the exposure and the hands-on experience of doing immunization assessments and administration in practice. Finally, for those pharmacists that are practicing, there is limited success of the incorporation of immunization services into the regular pharmacy workflow. Pharmacy workflow is set up for the dispensing and the counseling on medications. Providing an immunization service requires a team-based approach, a high level of knowledge, and a complete restructuring of the business model. Few pharmacies have been successful in doing that. There's also challenges in terms of reimbursement, so that goes back to the limited success into the pharmacy workflow. There is quite the discrepancy in terms of how much pharmacists are reimbursed for influenza vaccinations across the country. Starting out west, where the reimbursement for a publicly funded influenza vaccine hovers around $12 to $13, and then out east, where it again hovers around $12 to $18, and then you see this dip in terms of those pharmacists in Manitoba and Ontario providing influenza vaccines for as little as $7 per injection. With the more diverse number of healthcare providers providing immunizations, there becomes a need for central record keeping. Again, the challenge is there are tools for patients to keep track of their immunizations. However, when we look at something like Can Immunize, it puts the patient at the center and is the sole sort of bearer of that information. And that's fine for the patient in terms of keeping track and reminding them of when things are due. However, if different providers are going to step in and provide convenient and accessible immunization services, there has to be a better way that they communicate with each other. Finally, when we look at the catch-up challenges and the topic of this webinar that's been put on by the University of Toronto and School of Public Health, we look at school-based clinics. And with the pandemic, we've seen some challenges, not just with the cessation of the school-based immunization program, but now the considerations for delivery of vaccines at school into the new normal. Student attendance being exaggerated, and the provision of other needed vaccines in addition to influenza, accessibility of sites. Another advantage and potential opportunity for pharmacists and pharmacies is to provide overflow for catch-up, where parents can take their children to the local pharmacy, perhaps a place that they have to get something else like a medication or a medical supply, and have that immunization done there. So that presents an opportunity to help catch up, and not just that, but also provide a convenient spot for those who may be uncomfortable being immunized in a mass setting. Finally, and this is perhaps my greatest goal with pharmacist-led immunization services, is not just to catch things up, but to improve things and to improve the uptake of immunizations. And whether it's an educational or a logistical concern, pharmacists can certainly address that. We look at HPV immunization rates, perhaps unfortunately the lowest uptake of all publicly funded school-based program vaccines. You can see in British Columbia, it's hovering at about 2/3. Many provinces very similar. How do we increase the uptake? Is it with pharmacists as educators and also as logistical providers of this immunization? Thank you for listening to this webinar presentation. You can check us out at immunize.io or contact us at info@immunize.io.